Welcome to the Transplant Department at University of Minnesota Health. From your first visit through your transplant and beyond, you'll be working hand in hand with a number of healthcare professionals who are committed to your overall health and long-term well-being. Due to the highly specialized nature of the transplant process, the medical professionals you'll be partnering with may have some unfamiliar titles, roles, and responsibilities. I'd like to introduce you to the members of our transplant healthcare team and give you a better understanding of how we all work together with and for you. Our transplant team consists of providers working together on patient care. They apply their knowledge and skills to the diagnosis, prevention, and management of disease. A transplant surgeon performs the necessary transplant surgery by replacing failing or damaged organs with donated ones. Anesthesiologists perform an assessment of patients before they go into surgery to make judgments about the safest anesthesia plan for each individual patient. They're responsible for placing patients under general anesthesia, providing anesthetics to make areas of the body numb, and administering sedation to relieve pain or anxiety. An attending or staff surgeon oversees the practice and education of medical students, interns, residents, and fellows, and is in charge of care throughout a patient's hospital stay. Medicine specialists are doctors with advanced education and training in a specific area of medicine. A medicine specialist works with the entire healthcare team, monitoring, evaluating, and managing patient care. A fellow is a medical doctor who is continuing his or her training to become a transplant surgeon or medical specialty doctor who cares for transplant patients. A fellow may perform physical exams in the hospital, participate during surgery, assist in the design of patient care plans, and write orders for care. Primary care providers are general family doctors, physician assistants, or nurse practitioners who provide care in a clinic setting. A primary care provider is an important part of a transplant patient's general health care before and after their transplant, and should be seen for non-transplant medical concerns. Physician assistants and nurse practitioners are also part of the surgical or medical team. They provide some of the same care as doctors, while working closely with a supervising physician, and may manage daily medical care in the hospital. Registered nurses and advanced practice nurses are valuable members in the administration and evaluation of patient treatment and coordination of care. A transplant nurse assists with admission to the hospital, provides bedside care while a patient is in the hospital, monitors and records patient vital signs, gives medications, uses specialized equipment to monitor physical condition, assists patients with walking, getting in and out of bed, or repositioning while in bed, works with the entire healthcare team to assess, plan, implement, and evaluate care, and prepares patients and their caregivers to successfully manage after surgery. A transplant coordinator is a registered nurse who's able to help with any issue or concern regarding transplant. They assist with the management of medical and social demands to reach health goals before and after transplant. Transplant coordinators offer education regarding pre-transplant, surgery, and post-transplant events. They coordinate the transition between inpatient and outpatient settings, including discharge teaching, outpatient testing, and clinic visits. They assist with transplant medications and labs, and partner with the patient and entire healthcare team to develop and maintain a plan of care that will support healthy results. A hospital care coordinator is a registered nurse who works with the healthcare team to plan a patient's hospital discharge. Respiratory, physical, and occupational therapists have a positive effect on a patient's long-term quality of life through diagnosis, treatment, and education. Respiratory therapists play a prominent role in evaluating and monitoring heart and lung function, providing inhaled treatments when necessary, and teaching patients to manage and improve their breathing ability. Physical therapists and occupational therapists assist patients in achieving a high level of functional independence. They use therapy and education to promote the ability to move, reduce pain, restore function, and prevent disability. There are many supportive services working to improve the quality of medical outcomes and experiences that are readily accessible to patients and their families. A transplant pharmacist is a crucial part of the healthcare team. They provide pre- and post-transplant medication education, assist in identification, management, and prevention of medication-related side effects, keep a watchful eye on drug interactions, offer guidance on affordable medication choices, and review medication for safety. A transplant pharmacist will be part of the inpatient team in the hospital, as well as accessible during post-transplant visits. A dietitian is an expert in nutrition that assists a patient before and after transplant to make the necessary changes to their diet to achieve optimal health. A dietitian will supply education related to healthy eating before and after surgery, the effect medications have on eating, calorie and protein goals to support the healing process, and supplements and tube feeding if required. Social workers have many roles in helping patients and families cope with the challenges of the transplant process. They assist with counseling, care planning, financial assistance, transitional and rehabilitative care when necessary, coordinating discharge, and patient advocacy prior to transplant, while in the hospital, and after discharge. A financial case manager provides assistance to patients experiencing hardship or those having difficulty managing their medical financial situation. Chaplains offer ministry and spiritual guidance to patients, family members, and caregivers within the hospital setting. We trust this information has been helpful for you and your caregivers. Your entire healthcare team here at University of Minnesota Health looks forward to supporting you throughout your journey.